Hello everyone and welcome to this audio podcast. This audio podcast as part of a Pathology Chronicle. This audio podcast as part of a Pheno Rage, and this audio podcast as part of a Storm Robotics production. Through this audio podcast today, looking at what could be done better as part of published works from in around 2023, looking at leadership and management and what it should mean in pathology. So, what can be done better? So, an evidence-based recommendation for change in practice could also include a robust pathway to encourage and develop future healthcare scientists or healthcare scientists and scientist leaders and managers, thus bringing laboratory medicine bringing laboratory medicine and pathology more into the forefront. There needs to be opportunity, or there should be opportunity for healthcare scientists and scientists to tra- to tra- to train aligned to frontline healthcare professionals, especially to fulfill blood component requests and educational provision, supporting healthcare service users. One example might be where, for example, renal patients or patients who may have suspect or high risk renal insufficiency, and the idea ultimately is to ensure safe transfusion care and practice and prompt the concept of evidence-based practices as part of routine pathology practices, wherein scientists and healthcare scientists are wherein healthcare scientists or scientists are routinely referring to evidence-based with standard operating procedures, and there needs to be a step or a process whereby scientists and healthcare scientists are part of more involved multidisciplinary team or MDT practices. That draws this audio podcast to a close. This audio podcast is part of a Pheno Rage. This audio podcast is part of a Pathology Chronicle, and this audio podcast as part of a Storm Robotics production.